Hello and welcome back to another episode of Health Yes. Here at Cameron County Public Health, we talk about all things public health and more. I'm your host, Javier Chavarria, and today we are joined by Laila Rincon, an epidemiologist with us here at Cameron County Public Health with our very own preparedness program. Thank you for joining us. Go ahead and tell us a little bit about yourself and what you do here at CCPH.
Hi everyone, so my name is Laila Rincon. I'm one of the epidemiologists for Cameron County Public Health, and I've been with Cameron County for almost 6 years. This summer is going to be 6 years.
Mm-hmm. Okay, so the big topic that's been going on lately, measles. Tell us a little bit more about what that is, what's been going on lately, and what y'all have been doing on our end to deal with that.
So measles is a highly contagious virus, like we all know. It can spread person to person, but it can also spread from contact with any surfaces that person touch, or in the air, because it usually stays in the air for up to 2 hours.
What happens when there is a case confirmed? Talk to us a little bit about the process of how y'all deal with that.
So for our cases, we have what's called immediately notifiable conditions. So measles would be one of those. And how we usually get reports of these cases is through our physicians or our IPs, which are our infection preventionists that work for our local hospitals. We usually have really good communication with them. So most of the time they'll call us and notify us about their diagnosis. Then they'll let us know that they will be collecting a sample. That sample is later then sent to the laboratory. It usually takes about 2 to 3 days for us to get it. And then while we wait for the results, we try to contact the individual, let them know that they are required to isolate since it is highly contagious and it can spread to a lot of people, especially those unvaccinated. Then we begin also doing contact tracing, which is asking them where they've been and all the locations, things like that, to try to see who else they have been in contact and who else could be at risk. Gotcha.
Now, you mentioned contact tracing and isolation and all these things. A lot of that tends to harken back to the days of COVID.
Yeah, it's very scary.
Yeah, it's kind of a bit of a taboo to talk about things like that. Even the moment you mention isolation, case contacts, and all that stuff, people tend to panic a little bit. Like, are we seeing another COVID happening? Tell us a little bit more about the process of contact tracing.
So contact tracing, as you all were probably familiar with it in COVID, it's something we try to do to identify the people that have been exposed to a notifiable disease. In this case, it would be measles. So what we do is try to contact that suspect case, because until we get a confirmed laboratory result, then it's considered a suspect. We try to gather as much information as possible on where that person has been, including dates, times, locations, everything like that.
So the case that was confirmed here, that we got, was it a case that was confirmed to have originated here, or was it somewhere else and then it was confirmed here?
So the case was not originated here. It was a person that is from another state, was exposed in that other state, and then traveled to Cameron County. And as you know, like, it takes a while for symptoms to develop.
But once they develop
symptoms, they had come to a physician here, and that's how the physician knew about that person. They notified us that person had been exposed to someone in another state that had measles. So
and then the contact tracing began.
Yeah, so it would have been an out-of-state exposure.
Right. And then when it comes to all this contact tracing and keeping track with people's history, when it comes to knowing these symptoms and stuff, how do y'all keep track of cases? What do y'all use?
So we have our case, it's called our epilogue, and we have all our cases according to the conditions, the date we received, the date that it was closed, and
because we also, I know we also sometimes talk about something called MTRAC. Is that something that y'all use too?
Yeah, so for MTRAC we use for example, for vaccine preventable diseases. So vaccine preventable diseases, as you all know, it's things that we can prevent with vaccines. Measles used to be one of those. Unfortunately, now we have had measles cases in the United States recently due to lower vaccination rates. So that has been making a comeback. And Amtrak is a database that is for the state of Texas where all the vaccines are registered. So if I want to check if that individual was once vaccinated for measles, I would go into Amtrak, search up the person's name, date of birth, and their vaccine information should pop up. Ideally, it's our vaccine database, as you would say. But the problem with this is that not a lot of people know about it. And a lot of people had this vaccine when they were younger. So not everyone remembers having this vaccine. This vaccine, you get it when you turn between 12 months and 18 months. And then again, the second dose between 4 and 6 years.
So those shots that, you see people going to the clinics for, the babies that get the shots, those, at least back in the day, those are the ones that people were getting, right?
Yeah, so you get them when you're very young, when you're a baby, so you don't have any recollection. So if I call someone up that I'm contact tracing and ask them, have you been vaccinated for measles, which be the MMR vaccine for measles, mumps, and rubella, odds are they're going to say, I don't know, probably.
Right, like I don't remember, or maybe I have, but odds are likely that they have.
So that's a problem we encountered while contact tracing all the individuals that were exposed. We would call them up and they'd be like, I don't know, maybe let me ask my mom.
Right.
So they would go to their mom to see if they had the vaccine records. A lot of people couldn't find them. We usually don't keep them when you're adult. And if they're not saved on Amtrak, then we have no way of really knowing.
Right. Do you think that one of the causes for there being a case of measles is the low vaccination rates lately?
I think there has been like a certain vaccine hesitancy recently, and that could be one of the contributing factors of especially like vaccine preventable diseases that we used to not have and were eradicated already making a comeback right now.
Yeah.
So vaccines in general are very important that you get them on time and according to the schedule. So especially being vaccinated against measles can lower the risk of the infection becoming so severe that it can potentially become fatal in some cases. So being vaccinated diminishes the severity of the symptoms and can prevent it from even becoming fatal. And on the plus side, if you're vaccinated, you do not have to quarantine if you become exposed to measles.
You don't have to quarantine if you're exposed to measles.
No.
So talk to me a little more about quarantining.
Okay. So quarantine is very important if a person has been exposed to measles because like I previously mentioned, measles is so highly contagious, it can spread very easily amongst the unvaccinated. Therefore, if a person is unvaccinated, they're a lot more vulnerable to catching the virus and spreading it. So for this case, for example, we had to do all the contact tracing and all the people that the person that was positive for measles was in contact with. We had to call them, notify them about their exposure, and ask them for their vaccination records or ask them to get tested to show proof of immunity. If you do not have proof of immunity, which means that you had a vaccine of measles in the past, they would be required to quarantine for 21 days.
Gotcha. What do you want the community to understand about measles and the vaccination?
So I want the community to understand the importance of getting vaccinated. It's the only way to prevent getting measles. And I want them to also be very aware of the symptoms to look out for in case they are ever exposed to measles. They know what to look out for. So the symptoms would be high fever, cough, runny nose, conjunctivitis, which is mainly like your eyes turning a little red, and of course the very visible rash that usually starts around the head, around your hairline, and then it tends to spread to the rest of your body as the days go by.
Gotcha. Now, lastly, what is something that people may not realize about, Cameron County Public Health's role in the active case reporting?
So a lot of people don't realize all the behind-the-scenes work we do to keep our community safe. Behind every notifiable case, there's a lot of work in investigating, gathering as much information as possible, and doing all the contact tracing to prevent more cases from emerging and causing an outbreak like it's caused in other parts of Texas and other parts of the United States. So we do a lot to keep our community safe.
Very nice. Before we wrap up today's episode, could you tell us maybe something that we feel like we might have not touched on, something you want to tell the audience a little bit more about
So I just want to say my top 3 things that if you take anything from this podcast, you can take this.
Right.
Make sure you're on Amtrak. It really helps the health department and everybody else know what your vaccine status is. A lot of people don't know about Amtrak, so if you still have your paper vaccine card that we used to get before,
Right.
and you're not sure, take it to your physician at your next appointment and ask them if they can put it on Amtrak. That helps a lot when we're doing any contact tracing, any cases like this. Next would be, please try to follow the vaccine schedule. Keep your children up to date. Check if you're missing any vaccines. Try to get up to date as soon as possible. That way we can limit any of these vaccine preventable diseases emerging. Right. And last but not least, and very importantly, if you suspect that you or your child has had contact with measles and you're presenting with any symptoms, before going to your physician, before walking into the waiting room where all those people are, please notify them first, call them, let them know what you're feeling, the symptoms you're experiencing, and that you suspect measles or any other vaccine preventable disease. That way they can take the necessary precautions and you can limit the exposure that you cause to our public.
The last thing we want is to bring a child or someone with symptoms, spread them,
Yes, exactly. We just want to limit the public exposure as much as possible. Exactly. That way we can contain it before it spreads.
Gotcha. Sounds good. And with that, thank you so much, Lyda, for joining us on another episode of Health Yes.
Thank you. Thank you for having me.
Of course. Remember to all of our listeners to please make sure to follow, like us on all social medias, hit those notification bells so you don't miss out on another episode of Health Yes. Always remember, stay healthy, stay safe, and stay educated. We'll see you on the next one. Bye.